Here are your patient. You can read through it.
Is there any slides?
Just this one.
Okay. I'm ready.
All right. So if you've read and understood, considering it communication skills station, please begin.
Hello.
Hello, yeah.
I'm Dr. Ahmed Bashir, one of the surgical doctor here. I'm working in Dr. Man, for Dr. Man. I'm calling to ICU registrar to take an advice of preoperative patient and to arrange a postoperative ITU bed. Who am I talking to?
Yeah, I'm Dr. Nib, ICU registrar. So could you tell me about the case?
Okay. A 76 years old female, known case of COPD on steroid. She complained suddenly of abdominal pain, drowsy, and there is an examination. Patient feel ridged abdomen, and there is tender all over the abdomen, and she may need an urgent laparotomy. Could you please give me an advice about optimization of patient before operation? And
Yeah.
would you also please rate me to the postoperative ICU bed?
Okay, yeah, before the transfer. So what do you currently, do you know about the current condition? How was your blood pressure? How about the sign?
Okay, blood pressure is the, I feel like decrease in blood pressure.
Yeah.
Not measured yet.
So how about the blood investigation?
Okay, in her last investigation, there is hemoglobin drop in hemoglobin, and there is metabolic acidosis, and also there is the air under diaphragm and chest X-ray, and free fluid on abdominal ultrasound also.
Oh yeah. So you think that she had the perforated viscus?
Yes, she may have perforated viscus because the examination, the patient had tender all over abdomen and sign of proteinitis also, and air under diaphragm on chest X-ray, and
Oh yeah.
free fluid on abdominal ultrasound.
So she had a nauseous, drowsy, and blood pressure reduced. Do you do fluid resuscitation for her?
Yes, I will go to do a fluid resuscitation with the IV crystalloid, and I'm going to take a sample for blood cross matching. If there is no response to IV fluids, I will go for blood transfusion, and keep in mind the inotropes also.
Oh yeah. So before the urgent operation, what do you want to do for pre-op optimization?
I will do give a patient analgesia, give a patient the antibiotic according to the local policy and discuss with microbiologist and culture and sensitivity. Also, I will give a patient, I will put a NG tube and put a urinary catheter also, and do the investigation as baseline. Okay.
Yeah. So the patient has a known case of the COPD. So how do you arrange for his oxygen level?
Okay, patient has COPD. I give oxygen to the nasal mask, nasal cannula, and 4 liter per minute to keep the oxygen saturation between the 88% to 92%.
Okay, yeah, it's good, yeah. So how about the steroid? She is currently taking the steroid. How do you prepare for the steroid?
Sorry?
Steroids.
Steroid, yeah.
Yeah, about steroid before operation, yeah. We'll give the patient 100 ml of IV hydrocortisone with induction of anesthesia, and also give the patient 200 ml IV through 24 hours if we keep the patient fasting.
Oh yeah. So yeah, you have a good plan for the patient. So why do you think the patient needs to admit for ICU? Yeah. So can you tell me the criteria for the ICU admission?
Yeah, the patient criteria is 2 organ system failure with acute reversible injury illness, and 1 respiratory failure with the need of mechanical ventilation, and 1-to-1 ratio of nurse patient ratio, and if the 1 chronic system failure was affected 1 other system.
Oh yeah. Okay, thank you. So currently I have the only ICU one bed in my ICU. But there's a expected young lady coming first. So can you wait for
Yeah.
Yeah.
Yeah, I will keep wearing the patient, monitoring in the resuscitation room, waiting for available bed in ICU.
Okay, yeah. So I will call you immediately after the one bed available in my ICU.
Okay.
Thank
Well,
you.
thank you. Thank you.
We still have 1 minute left.
Yeah.
So what more you can ask him? You sure if patient took steroid inhaler today?
Yeah.
Yeah. After patient operation, I will double the patient after return to the enteral feeding. I will double the dose of steroid for 8 hours and tapering the dose until to regain the preoperative dose of normal patient.
How would you resuscitate? What fluid resuscitation would you give to the patient?
I will resuscitate with crystalloid, and I will give the patient take a sample for blood cross matching also.
Very good. Very good.
Yeah.
Yes. Okay. Have you looked for arrhythmia in the ECG?
Yes. No, there is no ECG available.
Okay, so you have to get that done. Now time is over. Okay, good. Thank you.
Thank you. Ma'am, I have